oh boy, it's windy. My mic's live. Hot mic, everyone. Listen up.
This is not windy. You want to be here.
It was windy in Newfoundland, I guess, last week.
Okay, I think we're ready to roll. I'm Wayne Easter, AFP for Malbec for the time being. And it's a pleasure for us all to be here at Murphy's Pharmacy with Ray and Carolyn Murphy, who started this operation many years ago for an important announcement today. Before I get to our initial speaker, I do want to recognize Zach Bell, who's an MLA, Heath McDonald, an MLA, and Gordon McNeely, MLA. And so I'll first introduce Minister Hajdu, who's the member for Toronto Bay, Superior North. And
No, Thunder Bay.
Thunder Bay.
Thunder Bay doesn't like being called Toronto ever.
Well, you don't know what
you have to, I'm sure you would understand that.
What we think of Toronto sometimes. Thunder Bay, Superior North. We're so glad to have you here, Minister, the Federal Minister of Health, and she will speak first and be followed by Minister Hudson. Minister Hajdu, go ahead.
Well, thank you very much, Wayne. And just on a personal note, I can't thank Wayne enough for being such an incredible member of Parliament and a bit of a guide for those of us newbies in class of 2015 who came in wet behind the ears and full of enthusiasm and brim and vigor. And Wayne's been a guide for so many of us, and me included. And Jennifer O'Connell has said to say hello to you and tell you how much she's going to miss you. She's a big fan of yours. And Sean Casey, great colleague. It's nice to see these people in person. We've been Zooming away and in question period, everything virtual. So it feels like family coming back to P.E.I. and seeing these two gentlemen who worked so hard for the region. And of course, Minister Lawrence McCauley, who can't be here, but just a wise voice around cabinet and one of the most honest truth tellers I've ever met in that room, never afraid to say the hard things. And so I'm blessed to work with incredible people, and I'm blessed to be here today. I'm also really pleased to be on your traditional territory of Eboguite, Mi'kmaq. I come from Lake Superior, not Toronto, Thunder Bay, on the tip part of Lake Superior in the traditional territory of the Anishinaabe of the Robinson Superior Treaty area. And I have the pleasure of living up there in Northern Ontario. It's a lot in some ways like P.E.I, isolated, hard to get to, hardworking people who earn their living traditionally from forestry and mining and aren't afraid to say the hard things. So whenever I come to the East Coast, it feels like I'm right here at home. Today, I wanted to talk a little bit about a really important next step on enhancing our public health care here in Canada. And I have to tell you, and I'm sure you've experienced this too, no matter where we go as Canadians, one of the things that I think make us Canadian and make us so proud to be Canadian is the fact that we have access to healthcare that is available to everybody based on their need, not their ability to pay. And that's been a defining thing during the pandemic. I think if we look to our southern neighbors, for example, where they struggled in the beginning of the pandemic with having access to testing, the stories that were coming out of people not being able to afford to go and get tested, not being able to afford to get treatment, the costs of getting access to healthcare in so many countries around the world. But Canadians have been privileged to live in a country where we know that no matter what your level of income or what your background, you can access healthcare in this country. It's a key Canadian value. And of course, there's a piece missing, and that's the access to affordable medication. And you know that this government, this federal Liberal government, has been on a journey towards enhancing access to medication through the creation of a national pharmacare program for some time now. And that's because for so many Canadians, the cost of prescription drugs is just so high. Some people, and I've met these people in my own real life, have a struggle between, they have to make a choice between paying for medication, putting food on the table, paying their rent. Early on, prior to the election, I ran a large homeless shelter. And we did have a plan, you know, for pharmaceuticals, but it was a homeless shelter. It wasn't that great of a plan. And I remember early on meeting one of the janitors that worked in that homeless shelter, and he asked if he could have a payday loan of $40. Richard, he's no longer with us, sadly, but Richard needed $40. And I didn't like giving those payday loans, those cash advances, because people never seem to be able to come out from underneath when they start to borrow money on their next paycheck. So I asked Richard, well, what is it that you need the money for? Maybe we can find what you need in a different way. And he needed it to pay the copay for his drugs because he was struggling with a form of pneumonia that just wouldn't get better. He needed an antibiotic and he needed the $40 so that he could get that prescription. And that's a real story. That's Canadians across this country from coast to coast. And can you imagine $40 was preventing him from feeling well, from being able to reach his full potential, and potentially, you know, luckily in his case, it wasn't a viral pneumonia, but you imagine how many people go to work sick and aren't able to treat their health conditions simply because they can't afford the medication. And no Canadian should be in that place. No Canadian should have to make that choice about whether or not they're going to eat or get to work or pay for the medication that they need. And that's been the premise for why we, years ago, decided we would start down this path towards a national universal pharmacare program. We've taken a number of steps towards making drugs more affordable. So we announced and we created a Canadian drug agency. This was about helping to negotiate better prices for Canadians. We also invested significant funds towards the creation of a rare disease strategy to lower the cost of drugs for people living with incredibly rare diseases, but that also have medications that are incredibly expensive. And today, I'm really excited to announce that we're taking another key step towards national pharmacare. The governments of Canada and Prince Edward Island have signed the first agreement towards a national universal pharmacare program. So through this agreement, the province will receive $35 million over 4 years in federal funding, and they'll add new drugs to its list of covered drugs and lower out-of-pocket costs for drugs covered under existing public plans for island residents. And I want to thank the minister for his incredible commitment to this vision and for being such a willing partner, because that's what this kind of work needs. It needs willing partners looking for solutions, coming to the table, having the hard conversations, and that's in fact exactly what Minister Hudson's committed to. So this is going to make sure that those really vulnerable islanders, uninsured islanders, seniors and families with a high burden of medication costs will benefit from improved access to drugs and a reduction or a removal of copays for some of those medications, just like the story I told you about Richard. Today's news will help bring P.E.I's drug plans in line with the other Atlantic provinces. And this is important because people in this province currently face some of Canada's highest out-of-pocket costs for drugs covered by public plans. Again, I think I can say proudly that Canadians believe in the right to accessible, high-quality health care, no matter who we are, no matter where we live across this country. And the improved and more accessible access to prescription drugs that islanders will see as a result of this agreement is a critical and important step on our path to ensuring that all Canadians have access to the basic medication they need when they need it. So Minister Hudson, thank you so much for your work and your commitment, the incredible conversations and your leadership in this province, and indeed, I think, across the country. And Canada is grateful. Thank you.
Thank you very much, Minister. A wonderful joint announcement. I recognize Brian Murphy has joined us now, President of the Murphy Pharmacy Group. I just want to add a local touch to your story while we're getting the podium right there. But Minister, I think you know Laurie Ellis. Well, her father-in-law was Dr. Ellis, and my office was next to his. An older gentleman came in one day who was fairly tight in cash, and he was on 2 cancer pills. And he said, I can't afford them both. And he said, so don't tell Dr. Ellis, but I've only taken 1. And I think that's a local story to add to yours, that how serious and how important this announcement is. So next, I welcome to the podium Minister Hudson, who's the Minister of Health and Wellness for Prince Edward Island, and knows a fair bit about the federal scene too, because he used to work in a federal minister's office provincially here for years. Go ahead, Ernie.
Thank you very much, Wayne, and it is a pleasure to be here with you this morning. Certainly great to see you out with us, Sean. Recognize that we do have three provincial MLAs, Zach Bell, we have Gord McNeely and Heath McDonald here with us as well. So great to see all of you. Certainly want to recognize the Murphy family too. Such a great partner, such great innovators in the healthcare and for the healthcare system here in Prince Edward Island. And my thanks to you for being here and for hosting us here on this beautiful Prince Edward Island Day. Minister Hajdu and I have, as she had mentioned, have had a number of conversations leading up to the initiative that we are announcing here today. And it's so great to be actually able, rather than by a conference call or a Zoom meeting or what have you, to be able to meet you in person. Had the pleasure of having breakfast with the federal minister this morning, and it gives that opportunity to make more of a personal connection, to find out just the issues that in her, not only in her portfolio, but in her riding that she faces on a day in, day out basis, and certainly appreciate sincerely your dedication to what we are announcing here today, Minister, but also the dedication and the leadership that you have shown over the last number of months as we've navigated these, let's face it, very uncharted waters of COVID. So thank you very much. And as the minister had mentioned as well, that federal minister, Minister McCauley, is unable to be here with us today, this morning. As I understand, has passed on his regrets. I would have loved to have seen Lawrence here, though, just to take a little bit of a story here. The last two announcements that I was present at with Lawrence, they were on the east side of the Hillsborough Bridge. So anyway, the last announcement certainly indicated to Lawrence a great partnership and appreciation that I and the provincial government have of working with Lawrence. But I also indicated I fully anticipate the next announcements that we're going to move to the west side of the Hillsborough Bridge, and ultimately maybe at some point we'll move even further west. But with that, just to follow up on some of the comments that Minister Hajdu has made and that Wayne has as well. It's one of the things since coming into the ministry as Minister of Health and Wellness, the meetings that we have, that I have, and the personal stories, the feedback that you get, and to follow up just with regard to one aspect that is always brought forward is I can't afford my medications. I can't be in a position, I hate to be in that position of having to make a choice between putting food on the table, heating, or getting and buying the necessary medications that I really require. And this is a major step through the partnership with the federal government to be able to provide that to Islanders. I'd also like to, at this point, before I get in to a bit more detail in my remarks, I know leading up to this announcement, the tremendous dedication and work that staff here on the island and staff in Minister Hajdu's office have put forward and have put out that have enabled us to be here this morning for this great announcement. So I want to certainly recognize all of the staff, both provincially and federally, that have shown so much dedication, so much support to both of us as ministers as we have been able to come to this point. So thank you for that. Medications are a critical part of our health care. Many Islanders currently face challenges in accessing and affording the medications they need to live a healthier life. Universal drug coverage with a strong federal funding partner through a national pharmacare agreement will improve access and reduce financial burden, ensuring that all Canadians have fair access to the prescription medications they need most. In PEI, we are always looking at ways to expand our formularies and make medications more affordable for our residents. Signing a letter of intent with the Government of Canada to move forward with a pharmacare demonstration initiative is a huge step forward, one that we are very pleased here in Prince Edward Island to be a part of. And this initiative is an important first step forward. It's an important step toward informing the implementation of a national pharmacare program. And I'd like to add, what better place to take that first step than right here in Prince Edward Island, where the first steps were taken towards Confederation. So it's a great place to take that first step and launch this initiative. This collaboration has the ability to enhance public drug coverage for eligible islanders and provide them with more affordable access. In addition to the National Pharmacare Demonstration Initiative that we're announcing and launching here today, I do look forward to our continued work, to our continued great partnership with the Government of Canada. Thank you.
Thank you very much, Minister Hudson. The podium there, Ernie said about Lawrence getting away. There's a joke around Prince Edward Island. It's hard to get Lawrence over the hills for a bridge. Out of the riding of Cardigan to the rest of the province. So we're always teasing about that. Mary, you can tell him we were talking about him. His ears should burn today. So it gives me great pleasure to introduce next Sean Casey, who's the member for Charlottetown, a great colleague to work with, who I know has worked hard on many issues, including the airport announcement made yesterday and the one made today. So with great pleasure, I introduce the local member of Parliament, Sean Casey.
Thank you very much, Wayne. Good morning, everyone. I too wish to begin by acknowledging that the lands on which we gather are the traditional territory of the Mi'kmaq of Prince Edward Island, Abeguit. They are the past, present, and future caretakers of these lands. Aussi, je veux dire que je suis très honoré d'être ici et d'accueillir le ministre de la Santé du Canada ici dans le berceau de la Confédération. Pour cette annonce qui va vraiment changer des vies de beaucoup de citoyens ici à l'île de Prince-Édouard pour augmenter le niveau de disponibilité des médicaments pour ceux qui ont besoin. I'm extremely proud and honored to be here as the representative of Charlottetown to welcome the Federal Minister of Health and to be part of this very important announcement, which will have a life-changing impact for islanders who have trouble accessing affordable medications. As Minister Hajdu has said, the COVID pandemic has shown us how important it is to have reliable access to healthcare services and resources, and that's why the Government of Canada is committed to working together with provinces, territories, and stakeholders to build on the foundational elements of a national universal pharmacare system. Here in PEI, residents face some of Canada's highest out-of-pocket costs for drugs covered on their public plans. This initiative is an important step in enhancing access to the prescription drugs and getting islanders the support they need. Our province is now in the process of reviewing its public drug plan system to make it more affordable and comparable to other provinces. The results of this review will guide the improvements that will be made as part of the demonstration initiative. I'm looking forward to this positive change. All Canadians are justifiably proud of our universal healthcare system. As we were having a chat before the announcement today, Ray, I'm going to use your line. We were actually reflecting on how extremely fortunate we are to live in Canada. And we've often heard it said that, those who live in Canada probably won the birth lottery, to which Ray Murphy added, and those of us who live in Prince Edward Island also had the tag on the ticket. Um, so true. In closing, I want to say this announcement to me speaks to a couple of things. Prince Edward Island is a full partner in Confederation. Prince Edward Island has the ear of the government of Canada. They care about the fact that the situation is dire in Prince Edward Island as compared to other provinces with respect to affordability of medications. And that's why the government of Canada is interested in this partnership. This also speaks to and you heard it from Minister Hudson, it also speaks to the excellent relationship the government of Canada has with the government of Prince Edward Island. This is one of many, many initiatives on which the two levels of government have collaborated. I have no doubt that there will be more. In fact, there might be one at 1 o'clock just down the street. You're all invited to attend. Our system is not perfect, but as today's announcement demonstrates, we'll continue to work toward our vision of equitable and affordable healthcare services for everyone. Thank you all for being here today. It's a big day and one of which we can all be proud. Thank you.
Thank you very much, Sean. And Sean, I think, summed it up well when he said about what the cooperation between this provincial government and the federal government can do. I know Premier King and Prime Minister Trudeau have a great working relationship, and it shows in terms of some of the joint initiatives that are taking place, this being one. And as Minister Hudson said, there's no better place in Canada to run this kind of a program in Prince Edward Island, where we don't have a large population, but we have all the communities, the schools, etc., that a larger province has. So thank you to both ministers, and thank you, Member Casey, for your remarks here this morning. I'll now turn it over to Oliver Cullen for a media availability. He speaks both languages much better than I do, so we'll turn it over to Oliver. And thank you everyone for coming, and thanks again to the Murphys for allowing us to host this here, and thank you for your efforts too in the healthcare system in Prince Edward Island.
You, Mr. Easter, and to all of our participants today, thank you very much. Tous les conférenciers, merci pour votre observation. Nous procéderons maintenant à la séance de questions et réponses de media. So we have media here on the ground, we have media on the line. So we'll start with media here on the ground. If you could just come to the pool mic in the middle, state your name and your affiliation. And one question, one follow-up, please. En question et après. Merci.
Hi, good morning, everyone. Stu Neapy from The Guardian. Welcome, Minister. Just wanted to get a little bit more in terms of specifics, and we're talking about a letter of intent for a pharmacare designated initiative. That doesn't seem to me to be the same thing as a pharmacare plan and funding for it for Prince Edward Island. So can you tell me the difference between a full pharmacare plan and a letter of intent for this initiative?
Well, maybe I can start, and then I think it'd be appropriate to turn to Minister Hudson, because he obviously knows the island pharmacare situation much better than I. But the letter of intent is with a financial commitment of $35 million over 5 years. So it's a letter of intent to work together to meet the needs of islanders based on the way that P.E.I. sees as the best and most efficient way to get to the goal of ensuring that people don't have excessive out-of-pocket costs. My understanding is P.E.I. has one of the most complicated landscapes in terms of public plans and a lot of complexity in how people are accessing drugs. And so this will enable P.E.I. to have the money and the commitment to continue to have the reform that it needs to make sure that we get to that goal. Again, the goal is that people aren't denied access to medication, like MP Easter talked about, like I told you about, that often we can't see. People might be covered by a plan, but the copay is simply too high and they still don't choose to fill that prescription or can't choose to fill that prescription. And so this is a firm commitment attached with significant dollars to make sure that P.E.I. has the financial resources and the support from Health Canada themselves to make sure that this project succeeds. It is also going to be a way for us to understand the extremely complex landscape of pharmaceutical plants across the country, over 100,000 plans in the country of Canada. And because of the complexity of PEI, it will give us the learning and the understanding that we need to take the next steps with other willing provinces.
Yes, thank you, Minister, and thank you, Stu, for the question. Certainly, this is the first step. This lays the foundation. As Minister Hajdu has indicated, 35.1 million over a 4-year period, as I understand. And it does, it's one of the challenges that I spoke about earlier, and that we heard Wayne reference, that we heard the federal minister reference, is just when we have meetings with constituents, meetings with islanders, meetings with Canadians right across the country, that we do here is that even ones that do have medical coverage or a drug plan, that the copay may be at a level that they cannot afford, and they have to make those difficult choices. In my opening comments too, I had mentioned that my appreciation and the federal minister's appreciation with regard to staff and the work that they have done so far. With regard to this initiative, there is more work to be done as far as getting right to having the I's dotted and the T's crossed. And I know that the workers, the employees, both within the province and within the federal government, will continue to do that. But it is a major increase in funding. Two of the things that we want to see here on the island is to make sure that all islanders have access to the medications and that that access is affordable to them. And it has to be right across the board. And as Minister Hajdu has referenced as well, what better place to look at the various complexities of the different programs that are in place and how can we streamline them potentially and then expand this right across the country, because PEI is not unique, but with that, it's an excellent location to start this process that ultimately I think that all of us here today hope will result in a national program at some point down the road. Thanks.
Follow up for Minister Hajdu, I guess, but also Minister Hudson. Why here? Why start with Prince Edward Island as opposed to, say, bigger, more complicated provinces?
Well, thank you. For one, we have an incredibly willing partner with PEI. And so Minister Hudson is really eager to work on this. Not all provinces and territories want to work on a national pharmacare plan. I always say start with the willing. And PEI, as I mentioned in my comments, also has one of the most complicated landscapes in terms of public coverage and, various different kinds of plans. So it gives us the opportunity to work at a smaller scale in a province that does have a complexity of plans with a lot of islanders that are still not included in being able to access medical medications because of co-pays and gaps in coverage. It allows us to take that really tangible next step in real life terms. There's been a lot of writing about how to do this, but this gives us an opportunity to do it in real terms and demonstrate to the other provinces across the country that it can be done and that it will end up in better lives for the people that they serve, but also obviously better opportunity for Canadians from coast to coast to coast. I'll just say this. If if medication is unaffordable to you, you can't access medication because of costs. There's not just the impact on your health, there's the impact on your ability to fully participate. And for me as a federal politician, that's the main driving reason I'm a federal politician, is I want people to reach their full potential. I want people to be able to fully participate in work, in their communities, with their families. And this announcement today gets islanders that much closer to that goal.
Thanks, Stu, for the question with regard to why here in Prince Edward Island. Certainly, I think the points that Minister Hajdu has brought forward are the most relevant, without a doubt. You look at the size, we are a province, but with that, we are at a size that things can probably be rolled out a little easier, a little faster. We do have that great working relationship with the federal government. So I would say that those are the two front and center reasons for here in the province. That in smaller jurisdictions, as I've said, it is easier to roll out new programs and also easier to evaluate them as they are being rolled out and we continue to move forward. Just on that question, to finish up, I think, again, the federal minister hit the nail on the head with regard to the impact that it has on the individual who cannot afford medication because of economic reasons, the situation that they find themselves in. It impacts their health. It impacts their ability to participate. And it also impacts the other family members that they have as well. So we need to be there for Islanders. We have been as much as possible. And as a result of this announcement moving forward, 35.1 million, we will be able to be there even more so as we move forward. Thank you.
Thank you for the question. Do we have any questions left on the floor? Yes.
Brian Higgins, CBC. I think we heard that it's a 5-year program. I think I also heard mention that it's a 4-year program. So if we just clarify that. Also, because it's a letter of intent, it seems there is some uncertainty whether it will actually come to fruition. I'm wondering if you can explain, perhaps say how likely it is that this money will get spent. And can you sort of describe in concrete terms, what are the hurdles? You've mentioned complexity. Could you just describe in tangible step-by-step milestones, what's got to happen to make this the plan come to fruition?
I can take some of those and I'll turn to my colleague, Minister Hudson, for some of the tangible steps ahead. It is a 4-year, $35 million commitment, and it's a signed agreement between the Government of Canada and Prince Edward Island. So that money is committed and it's available to Prince Edward Island, and we're a firm partner. And so Prince Edward Island can count on that commitment. That's the intent behind an intent that since is signed, is that it's an actual agreement. In terms of how that money can be used, I think that's what's exciting about this announcement is that there's an opportunity, given the complexity of public coverage, private coverage gaps that are unaddressed, to be able to have that flexibility with Prince Edward Island so that we can use that information that we start to gather with other provinces and territories that wish to pursue national pharmacare. We'll be there for any province or territory that wants to sit down and talk about pharmacare in their province or territory. This is just the beginning, and it's an exciting beginning because I think we're going to learn a lot together about how to make sure that we reach that goal, that people don't have to make choices about what they're going to spend their money on, and that getting their access to their medication is not seen as, there's no financial barriers to do so. I'm reflecting that we are making this announcement at Murphy's. I want to thank, first of all, the Murphy's for allowing us to do this here today. But I bet you afterwards, if you talk to the pharmacists and the pharmacy owners that are in this audience, they'll tell you the stories of the people that are really struggling to access medication and what happens to people when they don't have access. At the end of the day, this is a great news story for Prince Edward Island, but I also think it's a great news story for Canada. This is a tangible next step on a very difficult, complicated piece of work. And I'm extremely proud to be a member of a federal government that understands that, just because things are hard does not mean that you shouldn't take the next step. So I'm excited to be with two fighters behind me who know that and who have advocated so strongly for Islanders. And again, Minister Hudson's work on being willing to step up and even though it will be complicated, get this work done. It's going to have impact for generations to come.
Thank you, Brian. And just to reiterate, 4-year agreement, 35.1 million over that time period. As Minister Hajdu has referenced, and as I have, yes, it is a letter of intent. I think though you look back at the agreements that the province has had with the federal government as we move programs forward. I personally, as minister, have no concerns that letter of intent will be honored over the next 4-year period. It will undoubtedly have to be reviewed on a regular basis over that time period. And when I say reviewed, like it is to determine, again, to provide filler for where the gaps are right now that we know about, but also to be able to evaluate, are there unforeseen gaps potentially there that we do need to look after and take action upon. So with that, again, thank you for the question.
Thank you. My follow-up or, okay, thank you. Do we have any other questions on the floor? Les autres questions? No, operator, can we go to the phone for the first question, please? And just remind your name and your affiliation, votre nom et votre affiliation.
Thank you very much. Merci. So we'll take questions online via the Zoom. If you're a reporter and wish to ask a question, please use the hand raising function. Again, please limit yourself to one question and one follow-up. Nous allons maintenant prendre des questions des journalistes sur le Zoom. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. Merci. First question, notre première question vient de Gabriel Drummond avec Radio-Canada. À vous la parole, Gabriel.
Bonjour. Est-ce que vous m'entendez?
Oui.
OK, parfait. Alors, ma question, ça va être pour le député Sean Casey, une question en français. Alors, Monsieur Casey, j'aimerais que vous nous dites comment se sont passées les négociations pour conclure cette entente avec le gouvernement, entre le gouvernement fédéral et provincial, et quel a été le rôle des députés fédéraux dans ces négociations-là?
Okay. Si j'ai bien compris, c'était une question si j'avais un rôle dans les négociations qui ont produit l'annonce aujourd'hui. Est-ce que j'ai bien compris?
Oui, c'est ça. C'est juste pour parler comment se sont passées les négociations et quel a été le rôle des députés fédéraux de l'île dans ces négociations-là.
OK. Merci beaucoup pour cette question. Je peux vous dire que tous les députés au niveau fédéral ici à l'île de Prince-Édouard ont à quelques reprises soulevé les défis parmi les plus vulnérables ici à l'île du point de vue de coût des médicaments. Donc, c'est quelque chose qu'on a soulevé à quelques niveaux de temps en temps. Les négociations spécifiques, précises, ont été à un autre niveau. Ils ont été directement entre la ministre et le ministère, les ministères aux deux niveaux de gouvernement. Nous n'avons pas eu un rôle direct, sauf à souligner l'importance de cet enjeu qui absolument a attiré l'attention aux deux niveaux pour faire quelque chose. Ça, c'est pourquoi nous sommes ici aujourd'hui. Merci pour la question.
Parfait. Ma deuxième question, c'est toujours pour le député Sean Casey. Alors, l'île du Prince-Édouard est la première province à conclure cette entente avec le fédéral. Alors, j'aimerais savoir pour vous, qu'est-ce que ça représente pour l'île et aussi qu'est-ce que ça représente pour la vie des insulaires ici?
Pouvez-vous le répéter?
Alors, l'île du Prince-Édouard est la première province à conclure une entente avec le fédéral pour ce système de médicaments, ce régime d'assurance médicaments. Alors, qu'est-ce que ça représente pour l'ensemble de la province et qu'est-ce que ça va représenter, qu'est-ce que ça va changer dans la vie des insulaires?
Vraiment, je pense que ce sujet a été couvert pendant les discours. Mais ce que je veux vous dire, ça c'est vraiment, quelquefois, c'est un grand avantage d'être petit. Et ici, à l'île de Prince-Édouard, il y a quelques programmes pour le fournissement de médicaments qui sont plus complexes et moins généreux qu'autre part au pays. Donc, ça va faire une grande différence. Aussi, de point de vue de recherche, le fait qu'on est petit va donner un avantage de point de vue de analyser l'information et de ramasser l'information dans ce programme ici. Donc, je crois que nous sommes ici à l'île de Prince-Édouard des partenaires parfaits pour des projets comme ça, pour tester un concept qui peut être adapté dans les autres provinces à l'avenir.
Merci. Thank you. We do not have any more questions on the Zoom.
Sure, one more question from the floor.
I just posed for the health minister. I mean, there's the obvious question about timing. I mean, presumably this is something that the King government has basically called for a couple of years now. So why reach an agreement now as opposed to before now, or even 2 years ago or 1 year ago?
Well, thank you. I mean, first of all, I'll just say that National Pharmacare is a complex piece of work. And first, we've taken a number of steps, as I mentioned in my remarks, including the establishment of a Canada Drug Agency to help with creating the list of drugs that should be covered and how things should be covered. I'll just say this. Minister Hudson and I have been talking about this for some time now. There's an opportunity with a willing province to be able to get started. And it is a tangible next step towards a national pharmacare program. I'm very excited about the opportunity to work with provinces, other provinces that are excited and willing to do so in the near future. But this is about, again, today, a commitment to islanders to make medications more affordable and more accessible. And this piece of work, I will just say, is an important step to helping understand how to do this in the rest of the country. As I mentioned, there's 100,000 plans across this country, whether they're public plans or private plans. And that complexity has been obviously challenging to address as we start to think about what this looks like nationally. And P.E.I, as a willing partner, gives us some very early understandings as we start to have those conversations with other provinces and territories.
Thank you very much. Before the Island Breeze blows over the flags, I'll allow Mr. Easter to close out today's event.
Just to say thank you to everyone for coming. Thank both ministers and MP Casey for their remarks. This is a good launch to a new program that's going to benefit, yes, starting with Prince Edward Islanders, but be an example for all Canadians so that all our families right across this country from coast to coast and coast eventually can see improvements in the healthcare and the medical system that we have in this country by being able to afford the drugs they need to take care of themselves and their families. So thank you all, and thank you again to the Murphys for hosting us here on the property. And with that, people can mill around, but the press conference is now complete. Thank you all.